Hello friends, let's learn about basal cell carcinoma. It is highly important topic for any NEET PG and NEET SS examination. So we'll see the important point. Okay. So BCC is most common non-melanoma skin cancer. So overall BCC is most common skin cancer. Okay. Just remember BCC is most common. Okay. And it is the site is mainly the sun exposed area of the head and neck. Okay. And then the radiation, UV radiation is an important risk factor. Okay. So there is a intermittent exposure of UV radiation. So important is intense intermittent exposure. So BCC in Hindi you can just remember बीच बीच में, so intermittent. In SCC, in contrast, in SCC there is a chronic exposure. So anything related to chronicity, it will go in favor of squamous cell carcinoma. Okay. So and there is a hedgehog signaling pathway is a key signaling pathway. Okay. So there is a patch receptor release a transmembrane smoothened protein, SMO protein. So this may be asked in NEET SS, not in NEET PG. Okay. So next is no precursor skin lesion in BCC. In SCC there is a mostly precursor lesion will be present. Okay. We'll discuss SCC in separate video. Okay. So and the growth rate is a slow growth rate. Okay. And BCC commonly infiltrate locally but rarely metastasize. This is important line. Okay. Infiltrate but rarely metastasis is there. Okay. So and once metastasis develop, survival decrease to less than a year. Okay. So there are types of BCC. So first one is a nodular growth pattern. So nodular growth pattern is a most common type. Okay. So in picture based question you may get this picture and they can ask what type of skin cancer is this. So it's a basal cell carcinoma, nodular variety. Okay. So there is a typical classical sign, that is the central depression with umbilication or ulceration, and rolled edge is a classical sign. So that is the key is rolled edge. Okay. Everted edge you will get in a SCC. So rolled edge you will see in BCC. Okay. You can see this is a rolled edge. Okay. This is a rolled edge. Okay. So there are other variety, that is morpheoform BCC. Okay. So white scarring variety, this is called white scarring variety, and this is most locally invasive. So worst prognosis. So which BCC is having worst prognosis? So your answer will be morpheoform variety. Okay. So this is also a BCC. Okay. Locally advanced BCC. Okay. And the treatment will be surgical, mostly negative margin resection you will do, and the margin will be 5 mm, mostly say 4 mm. You will see when we will discuss in Bailey and Schwartz. Okay. So 4 mm is adequate, but in sabistion it's written 5 mm. We are discussing from sabistion. Okay. 21st edition. And then you can also go for radiation, cryotherapy, photodynamic therapy, and topical agent like imidacloprid. Okay. So central lymph node biopsy is not necessary for BCC. Central lymph node biopsy important in melanoma and squamous cell carcinoma. Okay. But not necessary in basal cell carcinoma. Okay. And there is a one inhibitor of hedgehog pathway, that is vismodegib. Okay. in name you can find the hedgehog spelling, bit of spelling, so you can remember through this way. There is a E, G, B, okay, O, all something is similar you have to find, okay. So this is used in a locally advanced BCC and metastatic BCC, okay. Okay, let's see what is given in Bailey and Love. So Bailey and Love say extra point we'll discuss. So arise from the basal epidermis, that's why it's called basal cell carcinoma, and hair follicles. So it affect pilosebaceous skin, okay, that you have to remember, okay. And then they can ask what is the strongest risk factor for BCC. You have to remember UVR, okay, UVR, okay. Okay, then there are the other risk factor like arsenal compound, coal tar, aromatic hydrocarbon, infrared, and ionizing radiation, and genetic skin cancer syndrome. So this all you can remember, but mostly they ask UV radiation, okay. And most commonly affected is, you can just remember, white skin male person, okay, white skin male person, okay. Okay, and the development of BCC is proportional to the initial dose of carcinogen, not the duration, okay. They can ask in other way, so you have to remember the initial dose of carcinogen is important, not the duration, okay. Okay, there are type of BCC but not that important. I already told nodular or nodulocystic is most common variety, okay. Okay, in microscopy there is a classical picture, ovoid cell in a nest with a single palisading, okay. This line you have to remember, okay. Ovoid cell in a nest with a single palisading, okay. And I told you morphic BCC, they synthesize type 4 collagenase, okay, and spread rapidly. That's why this variety is having worst prognosis, okay. Okay, they are the picture of BCC, okay, you can see, okay. Now come to prognosis. They have divided prognosis into two groups, high risk group and low risk. So you have to remember what are the high risk group, okay. So large, more than 2 centimeters are high risk BCC, and site like near the cranium, eye, nose, ear, recurrent tumor and immunosuppression patient, and micronodular and infiltrating type is having high risk prognosis, okay. So in surgery we have to do more microscopic surgery. We'll discuss in Schwartz. That's why we'll discuss in Schwartz. And in superficial tumor you can do topical 5-FU and imidacumod. Okay. 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 Let's see Schwartz. So basal cell carcinoma mostly occur age over the 60 year, and sun exposure is already I told, but it what type? UVB. You can remember UVB, B for bad. So it's involved in BCC, mainly BCC. UV also involved, but more B for bad. Okay. Okay. And there is also one question: the upper lip cancer mostly BCC and the lower lip cancer mostly SCC. So in alphabetical you can write B comes first. So upper lip B and lower lip S. So upper lip BCC, lower lip SCC. And most common malignant tumor of eyelid is also BCC. Okay. Other risk factor are like xeroderma pigmentosa, unilateral basal cell nevus syndrome, and nevoid BCC syndrome. Okay. Okay. And this is also called rodent ulcer. That nodular variety, that was the most common type, also known as rodent ulcer. So this also asked many times. rodent ulcer. BCC is also known as rodent ulcer. Okay. So there is a superficial spreading, that BCC can be mistaken as eczema. Other is infiltrative form, that's occur mainly on the fusion line. So that also you can. And morphia form subtype, that is the most aggressive subtype, already told you. Okay. So surgical excision, if small primary BCC on cosmetically sensitive area, you have to take margin of 4 mm, and otherwise it should be 10 mm. Okay, and you will do more microscopic surgical excision. Remember that. 1000 times ask more microscopic surgical excision. So what are the advantage of more microsurgery? Okay, so this is cost effective, low recurrence, treatment of choice for that aggressive BCC like morphia form variety and other aggressive tumor, and poorly delineated margin, recurrent tumor, and cosmetic sensitive area, mainly mid face. Okay, and in which case you can do quadrant restriction if that size is less than 2 mm. Okay, and other method are cryosurgery, laser ablation, radiotherapy. That's, and already told topical imidacloprid and 5-FU used for small superficial BCC of the neck, trunk, and extremity. Okay, so this you have to remember. So let's revise quickly what are the important points. Okay, that you must remember. We'll discuss that point in quick recap. So BCC is most common skin cancer. Okay, one. The sun exposure is intermittent intense exposure, though hedgehog signaling pathway is the key step pathway. Third point. Okay, no precursor lesion needed for BCC. Fourth point, this is commonly infiltrate but rarely metastasize. Fifth point. Okay, nodular variety is the most common variety. Sixth point, rolled edge is the classical sign. Okay, rolled edge. 7 point. Okay, that morphia form BCC is worst prognosis. Okay. Central lymph node biopsy is not necessary for BCC. Important point. Okay, that's it. 8 point are in sabistion. BCC original. Let's quickly revise the Bailey important point. Arise from basal epidermis of hair follicle, that is pilosebaceous skin. Okay. Most commonly involved is white skin person. Okay, white men. Okay. The initial dose of carcinogen is important, not the duration. Okay. And that microscopic picture, that is ovoid cell nest with single palisading. Important line. Okay. High risk area of BCC. Important question. More than 2 centimeter. Sites are the eye, nose, and ear. Okay. Recurrent tumor, immunosuppression, micronodular or infiltrating variety. Okay. And superficial, for superficial BCC we can use topical 5-FU and imidacloprid. Okay. Let's quickly revise the Schwartz point. Okay. Sun exposure, UVB, B for bad. Okay. Then that lip type of lip cancer, like on upper lip BCC, on lower lip SCC. Okay. Then the other important genetic risk factor like xeroderma pigmentosa, unilateral basal cell nevus syndrome, and nevoid BCC syndrome. Okay. Other important is it's a picture wise, it's a rodent ulcer. So rodent ulcer. Okay. And the advantage of more microscopic surgery: cost effective, low recurrence, aggressive type, cosmetically sensitive area, recurrent tumor, you can do. Okay. Okay. That's it. Thank you.